Welcome, MSK alumni. Again, I'm sorry to be speaking to you from my office in Manhattan as opposed to meeting at our annual function at the ASTRO meeting. I did go to Chicago in person, but we decided to cancel our usual meeting given that there was going to be a relatively small number of people attending. So let me give you an update, as I've done in previous years, to tell you what progress we've made in spite of these years of COVID. Well, it's been an extraordinary year and a half. We've seen a significant shift to people working from home. This is not just the faculty and staff working from home, but it's also our patients working from home. And what this has led to has been a significant shift of patients wanting to be treated in our regional sites. Patients live in our regional sites more than they live in Manhattan, and that has led to a significant shift. Thank goodness we built those regional sites, because it has been a major improvement in our ability to manage patients' needs during these COVID times. Now we are starting to see recovery. We're seeing a recovery back to the levels we were at in 2019. So by the end of 2021, we should be very much at the levels where we were at 2019. So essentially, it's a 2-year pause in what was otherwise our plan for continued development and continued growth. Let me tell you about some of the initiatives that we've been doing during that time. We've continued to make progress in our precision radiation initiative. This is an initiative where we're looking to give the dose of radiation that the individual patient needs, not the standard dose for a particular disease type. So, for example, many of you may be aware that in oropharyngeal cancer, we've reduced the dose of radiation from 70 gray all the way down to 30 gray for patients who have the right genetic and physiologic responses to treatment. And of course, this has a major impact in how the treatment is tolerated by patients. We've made additional initiatives in breast cancer and other diseases where the dose of radiation and the combination with systemic therapy, chemotherapy or targeted agents, that allows the optimum dose of radiation to be adjusted to the patient's individual tumor type. This is something we want to continue further, and we've challenged all of our disease teams to come up with their best idea as to how to address this precision radiation initiative. What I would like to say in addition is that we have continued to make progress in proton therapy. In spite of opening just before the start of COVID, the New York Proton Center has continued to develop, see plenty of patients, and is now treating more than 100 patients a day on a regular basis, in spite of all of the impact of COVID. So in our MR program, we not only now have 2 MR simulators, but we have now united the MR simulator program with the MR Linac program that we have developed at our new Coke facility at 74th Street. And this program now is doing very well, starting to treat significant numbers of patients per day, and also contributing to the technologically precise forms of radiation for both pancreatic cancer, liver cancer, as well as prostate cancer. So one other initiative I could tell you about is that as a group, we developed an application for the NCI request for applications for the so-called Robin Centers, the Radiation Oncology Biology Interactive Network. And our application was based around our precise radiation therapy with dose reductions in head and neck, and trying to compare this with the dose required to control cervix cancer. So we don't know how well that application will go. We are waiting for its review, but we hope even if it's not funded at the first time, it will be a basis for further programmatic initiatives. So those are some of the highlights from the last year. We are still facing challenges as an institution with a 2-year pause in essentially patient progress. You know, we still are recovering from the budget deficits of 2020, but are now at the point where we're budget neutral for 2021 and hope to move back into the usual black in 2022. I hope to meet with you next year, as I said last year, in person at the ASTRO meeting, and all being well, we will meet there together in the usual way. Until then, I hope you're all well, stay safe, and I hope to meet with you next year. Bye-bye.